Good morning, everyone, and welcome to our weekly live question and answer series where we sit down with an integrative medical physician and we answer your questions. We look to you, the audience, to submit your questions either in the chat section over here on the right-hand side. You do need to be logged into YouTube to do that, and you can start asking those questions even before we start going live. You can start posting that in the chat. I'm monitoring those and I will ask the doctor those questions. You can also email your questions in, and we got quite a few emailed in the past week. Our email address is office@tlcdoctors.com. Again, that's office@tlcdoctors.com. Just put in the subject line question for YouTube or live Q&A. They'll make sure that those questions are routed to me, and we'll ask those questions of the doctor. We don't prepare for this. Sometimes we have a topic to present, but really we just want this to be a time for you to ask any and all general health questions. And of course, we're an integrative medical office, so we approach things from a prevention first, from a functional medical standpoint, where we practice both standard of care, and our doctors are educated and very experienced in nutrition, which unfortunately most medical schools don't really incorporate into their teaching, and they should. Prevention should always be our first approach. Mm-hmm. Just want to mention a quick disclaimer that we do not want to replace your relationship with your doctor. These questions are not to be taken as specific medical advice. This is for educational purposes on how an integrative physician would approach your question if you were sitting in the room with them. We do encourage you to follow up with your medical questions and concerns with your doctor, and that doctor could be us. We are accepting new patients every day, both in person and via telehealth. So if you'd like to schedule an appointment with us, you can go to our website and you'll find our information there, our phone number, and our website is tlcdoctors.com. As always, as usual, I'm joined by Dr. Rita Ellithorpe. Thank you for joining us today.
It's always fun, Talon. I really enjoy this.
I do too. Let's jump into it. We had a few questions emailed into us this week. Ready to dive in? Okay, and of course, we're looking for your questions in the live chat as well there too. So questions that were emailed in this week. First one is from Sean, who asks, can you discuss the TLC approach to treating patients with autoimmune diseases, specifically multiple sclerosis? Also, have you heard of a therapy called Coimbra protocol developed by a Brazilian neurologist named Cicero Coimbra that uses high-dose vitamin D in conjunction with monitoring calcium and parathyroid hormone levels to overcome vitamin D resistance in patients with autoimmune diseases?
Well, I was not familiar with this Coimbra Brazilian doctor, and but I am familiar with vitamin D as an integral part of management of multiple sclerosis. That's been known by any of the physicians in nutraceutical research, functional medicine for decades. I do understand that high-dose vitamin D, and I compliment this Dr. Coimbra if that's what he's doing, and he's a specialist in neurology or something. I compliment him that he has embraced the natural medicine, the functionality of the human body working in a multi-system scenario. So it shows me that he's approaching it beyond just thinking of nerves and managing them with allopathic drug or steroids, things such as that. Now, what causes multiple sclerosis? And why would vitamin D be so beneficial in the management of multiple sclerosis should be the question. Why? Well, vitamin D is a fat-soluble vitamin. Do we have a group of people in the planet who have trouble digesting and assimilating fat and fat-soluble vitamins? And the answer is yes. And we've been teaching this for decades. And that is the blood group A type blood people. It doesn't mean they're inferior at all. It just means that's their particular liability. O-type bloods have another liability. B type blood, which I am, we have really big allergies, and I am suffering even as we speak, because Wednesdays are my gardener days, and the gardeners out here, and I get a whiff of all this. And so every morning when I start these videos, my nose starts running, postnasal drip, and congested and tickling, that kind of stuff. So each blood type has its liability. And A's don't digest fats well. Vitamin D is a fat-soluble vitamin. So it puts that group of people into a pool, you might say, that is more susceptible to the lack of vitamin D and all its ramifications. And unfortunately, vitamin D is more of a hormone. It's more like a steroid hormone. It actually has impact on our DNA. Many genes are impacted by vitamin D. Our immune defense, our bone health, our response to our mood. Vitamin D has neurochemical impact, and many others. So our approach to all autoimmune phenomena is to find out what is your blood type. To find out the greatest passage that will pretty much determine your outcome in this life, your longevity, your diseases, outside of your genetic blood type, and maybe some rare genetic issues, is what you're eating.
Right.
And the diet in America, my father was in food research with Armour Foods. The surveys of soil assays back in the 1950s when I was a little girl compared to soil nutrient assays today are dramatically depressed. I mean, we have so industrialized farming and taken away from the small mom and pop that really invested and loved their land and weren't so worried about, I'm sure they're worried about yield on the acre and what they're growing. But there was a lot more invested into the replenishment of the soil. So our food is inferior, nutrient deficient. Therefore, if you're taking in foods that nutrient deficient, then we genetically modify those foods. Then we put in genetic pesticide and herbicides like glyphosate and other things, and then we have aluminum hydroxy, barium hydroxy, strontium hydroxy in the geostratospheric engineering that's going on for climate management. And those metals, these are heavy toxic metals, land on the soil and they're grown up into it, and we're eating that. Then we have the electromagnetic energy issues. All these things impact your gut and how this is being treated. And remember, the lining of your gut from the corners of your mouth all the way down to your anus is a one-cell membrane thick, so it's easy to harm. Plus, the advent of overusing antibiotics can offset the biome, which is the good bacteria versus the bad bacteria, which assists in our immune function as well. 80% of our immune. I mean, how do you approach this? This is like teaching medicine right here.
Right.
So if you have breaches in your lining here, your immune system is alarmed. That immune system can cross-react with parts of your body. It could be your nerves, MS. It could be your thyroid, Hashimoto's, hypothyroidism. It could be your skin, psoriasis. It could be your lung tissue, asthma, your brain, and all these things. So your joints, rheumatidities, your cartilage. So the issue is the doctor of the future needs to be taught what we're teaching here. All medical school should incorporate this eclectic imagery in the mind of the doctor and not just be so super specialized.
Right.
Because I think if we restore the nutrition of the land, we honor and then process food, processing of food and the trans fatty acid hydrogenated fats, which that's what my dad specialized in. Your cell membrane that's so easily injured is a fatty floating layer that encloses your water aqueous cell membrane, and from the exterior water. So these fats are critically important, and if you're damaging the fats with Crisco oil, safflower oil, corn oil, cottonseed oil, rapeseed oil, canola oil, all these messed up oils, and cooking with them, you're literally crinking that membrane and putting your cells at a weaker disposition.
And we've been taught and conditioned to eat a diet in low fat because fat is bad.
It's not good. No.
Right.
That's the ignorance when you listen to government. And you could correlate that maybe with our current challenge for national health. We foolishly listened to McGowan's conference, Senator McGowan in 1972, the Commission on the Diet, a treaty written by his legal lawyer team, not really doctors, that were influenced by lobbyists to favor these synthetic oils that really have damaged America. And boy, did the Americans obey. We lowered our saturated fats and we increased in our what they call vegetable oils, seed oils. And we have seen a correlation with carbs, starch, cheap stuff going up, packaged foods, long shelf life, and heart disease, cancer, and all this autoimmune because of damage here. So that's how we approach autoimmune, and we incorporate the fat-soluble vitamins A, which is very important in your skin. So that's the long and short of that answer.
It's not a simple answer.
It isn't.
Because something that's an autoimmune disease is a very complex, multi-body system challenge to face. And so we start with a patient and learn from the time they were born to how they got here, what challenges do they face in their life, what is their blood type. We're testing them for food sensitivities that they might not be aware of. Then really we start teaching them how to eat, how to cook, and then you incorporate into that your medical approach, of course, too. Any IVs, IV nutrition, chelation.
Detoxing.
Right.
Yeah.
So unfortunately, there's not a simple answer, but the connection to vitamin D, we're not getting enough of it. There is a deficiency of vitamin D. It's a fat-soluble vitamin that's actually very much so like a hormone. Could be argued it's not a vitamin, it's a hormone.
Yeah. So, Dr. Coimbra, because right before Talon showed me your question, I did take a quick 1-minute look on my internet, and I saw that he's a neurologist in Brazil, and then he has a multivitamins there and minerals. Well, we've addressed all that, and yes, all the vitamins matter.
Okay, let's move on to the next question. It might be a similar answer. What would you recommend? This is from Christina. For someone who has lupus, are there supplements that can help with managing symptoms or a particular diet?
Absolutely, it's the exact same thing. Lupus is another autoimmune constellation of symptoms and lab phenomena that shows inflammation, okay? And where it sequesters in you is probably somewhat your diet, your environment, your blood type, and so forth. So it's really all the branches on the trees are the ultimate your environmental impact, but the trunk of it and the roots are based in what we just discussed.
Right.
So I would want to know her blood type. I would want to know where she was born, her life stressors, her travel, how many antibiotics she used, what her diet's been like, and go forward from that. Now, there's a good YouTube video to watch put out by the organization Weston Price, and he was a dentist that was looking at why primitive non-industrialized people didn't have cavities. And he looked at their diets all around the world in the 1920s because a new technology came out back then called the camera. And he started taking pictures all over and looking at their beautiful teeth and stuff. And he is to be credited with what was called Factor X. Factor X was very important in having a nice broad face, teeth that came together without orthodontics. Factor X is a fat-soluble vitamin K. Okay, so watch this video called The Oiling of America. The Oiling of America. Dr. Engel was one of the biochemists. I think she was at Columbia or Stanford, some East Coast big think tank research center in the fatty sciences. I know this because my dad was involved in it, and I heard about it all the time, especially with McGowan and all that war on cancer and heart disease. And her science, and plus many others with her, she had reams of data, like from Weston Price, how important saturated fats were. This was literally pushed aside. They ignored her, censored her, and we were shammed with this saturated fat fear through government edicts, and it's harmed the entire population. Okay, so you watch that, The Oiling of America. Sally Fallon, because Dr. Engel couldn't be there for the lecture, so Sally Fallon, who helps run Weston Price, delivered it. She did an excellent job. It's I think it's about 10 years old now, but it's an excellent scientific review and of the history and the corruption. So beware, about looking to your government for an answer. If they're wrong, they can really harm a population and generations to come.
Right. Okay. I'm going to hop into a question on the chat in the live stream. A question from Amela asks, a 70-year-old female, blood type A with Hashimoto's thyroiditis, has low white blood cell, 3.4, and low platelets on her lab work. Her vitamin D level is 83 and she's pretty healthy. What could be the reason for that? How could she boost her white blood cell count and platelets naturally?
Well, platelets, it depends on what you're going to consider low. We don't even treat a platelet count for thrombocytopenia of concern for bleeding out unless it's about 40,000 or less. And I've seen and managed patients even in 25, 20,000 because we don't like to give medications. So I work closely with the hem-oncologists on this, and so you really have to get very low. Now, the labs on the blood count say a platelet count of 150,000 roughly to 450,000. If you have a platelet count of 80,000, 70, 100,000, I think you're fine. I wouldn't worry about it. The total white blood cell count I'm seeing almost everywhere, ubiquitous in the American culture. And when I was a young doctor 40 years ago, I would see everyone with a white blood cell count of 8.9, 9.3, 10.1, 7.8, okay, on the white blood cell counts. Now I see it 3.2, 3.1, 4.7. Why is it we're shifting down? It's because of all the immunological stressors on our body, our poor diet, our lack of digesting and absorbing to make the protein amino acid absorption to make the cells.
Right.
The toxins, the heavy metal accumulation in the bone and marrow, and that's where your blood cells are made. Are surrounded by a lifelong accumulation of lead, aluminum, mercury. If you read my paper or you go to our website, our tlcdoctors.com, go to the blog, read my paper on heavy metals and its impact on the immune system or the neurotoxicity of it, and that's a contributing factor to MS.
Right.
So that's how I would address it.
Okay, so depending on what her platelet count is, you might not even be concerned. A white blood cell count of 3.4, you're not alarmed necessarily.
I'm not alarmed.
You're seeing a lot of that.
I'm seeing a lot of it. I'm saying the vast majority of all my patients are coming in about that range.
And if this 7-year-old woman was sitting in front of you, you would dig a little bit deeper and maybe make some suggestions for chelation therapy if she was high in metals, or
look at her digestion a lot better.
Right.
Mm-hmm.
Okay.
Look at her hormones. As we lose hormones with aging, natural hormone replacement therapy would be a consideration as well. Digestive enzymes.
Yep. Okay, I'm going to go back into some questions that were emailed here. I have a question from Ophelia who says, I have been having eye twitching in my left eye for over a month, and at times it feels like I have a grain in my eye. I went to the eye doctor. He said all is fine. He prescribed eye drops for dryness. I'm noticing more instances of floaters. He said some floaters in my right eye. He saw some, but I see them in both. Should I be concerned? Could this be an underlying problem with some other issue?
Yes, and all of us with age, and ultimately we're all going to die. Now, what is that process that brings us to the grave? Oxidative inflammatory stress. Not drinking enough water every day will give you lots of floaters. Eating too much sticky candied bread, pasta, cracker, sugar, fruity tutti foods will thicken the blood and make it sticky, and the blood flow can't get there. And you have to understand the capillaries back here are just absolute tiny. Minuscule. So if you don't drink water, you have a high standard, typical American carb diet, you're eating the processed fats, vegetable oils, PUFAs like that, then you're going to have trouble. And we all lose enzymes with aging. Enzymes help clean out, the lining of our blood vessels, disinflame it. Yeah, it's like the soap suds in the body. Lack of exercise. All of us getting older, the hydrostatic volume and the circulating pressure is a problem. Then you can start talking about hormone replacement. You can talk about vitamins, and the number one nutrient I give is the Juice Plus series, because if you want an antioxidant proven 42 and DNA, I think there's 7 different studies on DNA reduction of damage. I mean, what other vitamin could you ever bring up out there that has so much science behind it, slowing this aging process? So your floaters, these are oxidative stress, bioaccumulation of little protein matrices that are very irritating. This is a signal to your body as if a fly is coming by your eye. So if your fly or a mosquito's here, you're going to twitch, okay, and you're going to bat it away. But you know there's no fly, you know there's no mosquito, so you're going to twitch. Anyway, another thing is stress with B vitamin deficiency. So if you're B vitamin deficient, you'll tend to actually feel your muscle there twitching. So there's several things I would address there.
Okay, great. We have a question that came in the chat from Robert, and he says he gets cold when fasting. He eats a low-carb diet, and he's doing chelation. Any ideas why?
He gets cold when fasting. I don't think he's drinking enough water then.
Okay.
I would say you should, if you're fasting, drink a ton of water, because remember, your body is then going to go into autophagy. And it's going to start eating up old debris, damaged cells, which we want.
Right.
But as you do, you're increasing little tiny waste fragment, the stinky dirt of your body.
Yep.
And that is a signal of itself. God is so smart that the waste material is a signal of cell damage for the body to respond. One of the things in response is your cholesterol will go up, because all cell membranes have cholesterol in it. So cholesterol elevations are not necessarily bad at all. So if he needs enzymes, he needs a lot more water probably, so that as he goes through this autophagy and this cleansing, those little fragments are cleared out, and then he should have a better temperature. He should also be seen. We got to check his thyroid, his free T3. We've got to look for, how old is he? What is his peripheral circulation? Could he have damaged endothelial lining and plaque buildup?
Right.
To his extremities. So that's how I would address it.
Okay. We have a question in from Victor, and the background on Victor's question is he's looking for the best nutrition program for a 90-year-old male facing immunotherapy treatment for melanoma of the scalp, commencing on March 22nd. We don't know whether it's metastasized to his brain, as the oncologist has not scheduled a brain MRI. So question 1 is, What are your recommended nutritional supplements to strengthen the body's systems and help combat the effects of immunotherapy drug, brand name Ketruta, drug name pembrolizumab,
Ketruta, yeah.
to be administered via IV? So nutritional supplements to help combat the effects of immunotherapy.
Well, I'm familiar and have had patients with Ketruta for melanoma, and it can be dramatically, impressively helpful. Okay, and it works as an immunotherapy, and it's helping your innate immune system. And that's really, these vaccinations for COVID are working on making you make antibodies, all well and good, but our immune system is so vast, so intricate, so ready at a moment's notice. And the innate system has the natural killer cells in it, these T cells, and the orchestration is so phenomenal. It makes you just stand in awe at the human body and its microphysiology. Ketruta is working in this arena. And I think your father, 90-year-old, should do well. It typically is well tolerated. What would I do alongside this? Well, we believe in a very low-carb diet because the insulin is a growth promotion, okay? So any starch or fruit, sugar, carbohydrate will promote and stimulate growth when you're trying to stop it. I would be on high enzymes, systemic enzymes and digestive enzymes. I'd find out your father's 90-year-old's blood type. But irregardless, at that age, nobody's digesting as well. And so digestive enzymes to help him break down the fat soluble, I would have him on vitamin D along with enzymes. I'd have him on the Juice Plus series, a powerful antioxidant series, enzymes. I honestly would give him high-dose vitamin C in between treatments. There's a lot of information about how high-dose vitamin C kills any cancer stem cell, okay? So there's many things. I would feel very good about Ketruta.
Okay. And a follow-up question to that is, some medical practitioners say that a person who is undergoing treatment for cancer should not take any nutritional supplements because the supplements feed the cancer. Do you agree or disagree?
Well, I disagree because what is the training of oncologists and people who make this? Basically nothing. I've been doing this 40 years and all I've seen is wonderful success. And now I would say if they are concerned, like it bothers me, oncology office, I have many patients who I work with their oncologists, they come here and they tell me while they're waiting there for their chemotherapy, there's a bowl of candy, or there's orange juice and sodas there. How ridiculous. It'll raise up the insulin and promote growth and so forth. So I would absolutely say no, nutrients aren't the problem.
And they don't feed the cancer, but I have heard oncologists often explain to their patients that chemotherapy is a oxidative treatment, and taking vitamins, which are antioxidants, are going to somehow neutralize this. Maybe that's what he's getting at.
Yeah, and that is probably some of what they're saying. And what is the window of time for the chemotherapy? The window of time for the chemotherapy is really within 24 hours, okay, or less, because there's a G cell, S phase, G phase, in which when cells are dividing and doubling, that chemotherapy is hoping to get in there during the rapid turnover of cancer cells that grow faster than your normal cells, so that the chemotherapy messes up that mitosis. Well, it isn't doing it forever, okay? So there is really a window of time, which is at the time and hours afterwards. So the window of time is important to understand. It doesn't go on for days and days and days and days and days. The reason why you have to have 2-3 weeks between your treatment is they'll kill you if they give you too much chemotherapy. And so your body has to recover. It's not that it's in its therapeutic state of action necessarily. Then the other thing is high-dose vitamin C is a pro-oxidant, okay?
It's oxidative.
So if you're taking 1 gram of vitamin C, 500 milligrams 2-3 times a day, that is an antioxidant, okay? And we recommend prior to chemotherapy that you go in fasting.
Yes.
Yeah, 1 or 2 days on a water fast before chemotherapy has been shown to advance and enhance the powerful impact of that infusion.
Right.
All right. So if they're going to really say anything, they should be telling their patients to come to them 24-hour minimum fasted, better 48-hour fasted.
And if you're undergoing chemotherapy, you want to work with an integrative doctor that's experienced working alongside the oncologist,
right,
who understands the timing and the treatments and the fasting and when to do certain IVs in between and how to help recover and weather that storm of chemotherapy. Last follow-up question from Victor, and this is probably the last one we'll have time for today. We are making note of questions that were not asked, and we're going to answer those on the following week. So he says, if there is a limit to the number and or type of nutritional supplements that may be taken during cancer treatment period, what are the top 5 nutritionals that are most vital to take over the course of treatment? So I think we answered that you shouldn't be worried about vitamins feeding the cancer per se. What are the top 5 that you would say in general would be taken for a cancer patient undergoing cancer treatment?
Enzymes, systemic enzymes like Vitalzyme or Vascuzyme or Proteozyme taken on an empty stomach to help break up the debris of this. Number 2 would be vitamin D, okay, to enhance the natural killer cell and help them to identify cancerous stem cells and kill them. Number 3, a good multi-mineral with selenium, zinc, things like that in there. Number 4 would be something like curcumin or turmeric. And number 5, I would have them on actually a ketogenic type diet.
Okay. Great. Excellent questions, everybody. We got a lot of them today. We had a lot of questions emailed in and more in the chat that we didn't have time to get to today. We will make note of those to make sure that we get those answered in a following session. I'm ready to take up and do my webcam on the evening. Okay.
And so what I'd like to ask the audience, or if they would email us, is what evening would be the most viewed evening of the week? So should I do it Thursday nights, Friday nights, Saturday nights?
Okay.
You know,
Dr. Elthorpe would like to try doing an additional live question and answer series during an evening of the week. So you can email to us, office@TLC Doctors, your suggestion of what time you think that would work. That'll be a trial. We'll see how it goes, and it'll probably be just Dr. Elthorpe, just unfiltered at her laptop, looking for questions in the YouTube chat. So email those suggestions into office@tlcdoctors.com.
And I'll let them know next Wednesday what night we decided and the time. So put in the day of the week and the time in the evening that you would be most likely to tune in, or your family to tune in. And be mindful, I'd like to try and get some East Coast people. They're 3 hours ahead of us, so I'm looking at starting at 6:30ish.
Okay.
Yeah, 1 vote for Thursday nights.
All right.
Thursday nights, okay.
I do also want to say we've been getting a whole lot of questions from our patients here and emailed in and on the live Q&A about COVID and vaccinations. I'm looking at some that were emailed right now. So we're planning to probably start next week's Wednesday live Q&A off with just an overarching answer to a lot of these questions about COVID, the vaccines, diet, nutrition around it, masks, that type of thing. So we'll be prepared to have some material on that and get those questions answered next Wednesday. So if you have friends, family that would like to hear how we're dealing with COVID here with in this office with our patients, tell them to tune in next Wednesday at 9:45 a.m. Pacific. We're here every Wednesday live with you guys at 9:45 a.m. Pacific time. And email your questions into us, office@tlcdoctors.com. We'll take note of the questions that we couldn't answer today in the live chat. And thank you so much for joining us. Thank you for your time and attention and for participating. We love this to be interactive. Thank you, Dr. Althorpe.
Thank you,
Everybody,
Tim.
take care and be well.
You got 4 votes for Thursday night.
Okay, all right.
Yeah, Thursday.